Hello friends, welcome to the another episode of Decode ECG series. Today we have got an ECG. Let's decode it. See, in any given ECG, first we have to check whether it is taken properly or not. The standardization of the ECG. So here the paper is running at 25 mm per second and 1 centimeter is equal to 1 millivolt. This is taken at normal standardization. And let's begin. So after ensuring that it is taken with normal standardization, we have to check rhythm. So to check rhythm, we have to see P waves. So rhythm. Let's check. Rhythm is seen in lead 2. Lead 2, there P wave, P wave, P wave. So lead 2 is given here. Let's look at this. This is lead 2. So this is P wave. This is P wave. This is P wave. P wave. P wave. Look at here. What happened to P waves? They are of different morphologies. See this P wave, how it is, and see this P wave. This is inverted. This is tall, and see this P wave. So they are all different morphologies. See here. So one type, second, third, and fourth. So here more than 3 different morphologies of P waves are there. So it could be, that means whenever there are changes in P wave, that means there are more than one foci that are present. That means sinus rhythm, the electricity is not just generated by sinus rhythm, sinus node. It is also generated by some other foci, ectopic foci present in the atria. So if every beat is generated by sinus node, every P wave will be similar. So here the P wave morphologies are different. That means there are so many foci which are generating the electricity rhythm. So it is multifocal atrial rhythm. Multifocal atrial rhythm. Next we have to calculate is the rate. So how to calculate rate? 300 divided by, first, whether the RR interval is regular or not, we have to see. See what happened here. See how many boxes are there? 1 big box, 2 big box, almost 2.5 to 3. 1, 2, 3, 1, 2, 3, 3 more than 3. 1, 2, 3, here 1, 2. So it is keep on varying. So there is irregular rhythm. So irregular RR interval. Irregular RR interval. And the rate is around, we have to, whenever the rhythm is irregular, we have to calculate rate by calculating a number of R waves in 6 second strip, multiplying it by 10. So what is 6 second strip? So you have to calculate that in 30 boxes. 6 second means 30 box. So let's start from here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So in 30 seconds there are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 12 boxes are there. So 12 into 10 means rate comes around 12 into 10, rate comes around 120 beats per minute. So there is tachycardia. So there is multifocal atrial rhythm with tachycardia, means it is called a multifocal atrial tachycardia, and there is irregular RR interval. So whenever you see irregular RR interval, you have to see whether P waves are not there. If P waves are there, that means see here P waves are there here. Identifiable P waves are there. These are your P waves. Since P waves are there, it is not atrial fibrillation, it is multifocal atrial tachycardia. Then there are no atrial fibrillation, and there is no flutter waves also. And there is, see, after calculating rhythm and rate, you have to calculate axis. So what is the axis in this ECG? So for that you have to see lead 1 and AVF. So in lead 1 predominantly QRS is predominantly negative, and lead AVF predominantly positive. That means there is right axis deviation. Right axis deviation. Next, after calculating the axis, you have to see waves. So that means whenever you get RAD, you have to always look for RVH, whether RVH is there or not. For that, you have to see R wave in V1 and S wave in V6. See, R wave in V1, see, this is V1, R wave, this is the R wave. How much mm? It's almost 1, 2, 3, 4 mm. And here deep V6, S V6. See here, 1 box, big, 2, 3 box. So 3 means 15 mm. 15 plus 4, 19 mm, which is more than 7 mm. So there is RVH. RVH is present. So if everything put together, there is multifocal. So there are more than or equal to 3 different P waves and tachycardia, and there is irregular rhythm, and there are no flutter and fibrillatory waves. So it makes the diagnosis of multifocal atrial tachycardia. That means if you want me to show in pictorially, see, if sinus node generates electricity, all the PV will be same. So there is one more foci here, one more foci here, one more foci here. Okay, when there are more foci, what it will do, they will also generate electricity. So there are different P waves you will see, and since there is more electricity, there is a tachycardia. More number of times firing will be there. So this is case of multifocal tachycardia, and it is seen in patients with COPD. This patient actually presented with the dyspnea and chest pain and wheezing. On examination, wheezing was there. So this is a case of multifocal atrial tachycardia. Hope you got some information. Thank you.